to get your thoughts and comments as we continue to move forward. And although this project is quote unquote based in Durham, as I mentioned to Melissa and to Shamika, as we have data from their counties, they can be included as well, because we're covering Region 4, which includes lots of counties. Okay, so let me see. So I introduced everybody, and we could go through the popcorn thing, but we're just going to go ahead and go through this really quickly, if you don't mind. So I'm sharing my screen. Okay, so. And so one of the things that we recognize is that our young people are in crisis. And at this point, we actually have a resolution that I believe was included in the email that I sent to you all, sent to Melissa for Chief Barrow, so that you will have access to the resolution, which I'll briefly go over as well. And so we're the nonprofit arm of this process. We use the public health model in order to address many different things, but one of them is violence. And then we have other folks that are a part of this as well, including the awesome Fred Johnson, who's the chief of everything. But then Kendrick Kennedy and Christian Peen as well. And they are emergency medicine folks and trauma surgeons. So we went over the youth risk behavior survey. One of the things that I pointed out is that in the youth risk behavior survey, as a resource, T.R.Y is mentioned. And even though it mentions Durham T.R.Y, we've expanded. So we're across North Carolina, several states, and internationally. But we're glad that it's identified that our processes are working. And one of the things that we're proud of is that the things that we do are recognized by North Carolina Youth Prevention Education Standards, and we're a certified provider. We mentioned adverse experiences, which has to do with adverse climate, childhood, and atrocious cultural experiences. And people need to know about ACEs because it can lead to violence among our children as well as in the community. In terms of ACEs, if someone experiences 4 or more of these challenges before their 18th birthday, 4 or more, and then you can just read what those are, including racism, then they can have outcomes that are very detrimental, such as lack of physical activity, smoking, alcoholism, drug use, missed work, severe obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, broken bones, which also stands for violence. And stress, toxic stress, is the point where stress becomes biologically embedded, and that's why it leads to those outcomes that I mentioned. There's also a video of the meeting, and that's why I'm going through it so quickly, because if you want to see and hear the entire process at your leisure, then you'll be able to do that rather than my spending an hour talking about all of this, because I want to get to our solutions that the community has identified along with T.R.Y. And so we look at resilience as a journey in 5 areas: emotional fitness, physical fitness, spiritual fitness, family fitness, and social fitness. And so we want to make sure that the community is aware of how they can build resilience, and using community health workers who are reaching out to as many people as they can. They're talking about these 5 areas and helping the community to identify at least one area where they will try to implement some of these things, or they may have other things that speak to resilience for themselves. So they don't have to be within these areas, but they can identify those strengths as well, or what leads to strength. So when we looked at violence, this is from the North Carolina Department of Health and Human Services, and they actually identify county by county what circumstances of homicides look like in a particular county. So this is Durham, and they looked from 2011 to 2020. This data is available for your counties as well. And as I mentioned, Melissa, and also to Shamika, we're putting this together for all of our counties. And so the reason that we're looking at data, of course, not only is because data is important, but we really need to hone in on what the challenges are in our particular areas. And so what you see here is that in Durham, intimate partner violence is of the greatest concern among males and females, more so females than male, because people want to jump to gang violence or something like that. And even though these are issues that we need to talk about, we can't not talk about intimate partner violence. So in terms of gang activity, because people are so focused on gang activity, high school students reported gang activity at their school. This is according to the 2019 YRBS. And Black high school students identified knowing that there's gang participation at their school, and you see the percentages there. And so we know that that gang activity is happening at school, but what does that really mean in terms of the scope of violence? So this is the surprising information, parts of it, but this is from the Durham Gang Report Survey, Gang Report 2021. And so when we think about who's really involved in homicides and aggravated assaults, and this is specifically in Durham, are we talking about gang members or individuals that are not gang members? And so this is where we come to the point of how do we address, what do we address, and changing the perception of what the challenges are. So under homicides total, aggravated assaults total, we look and see that we need a holistic approach to the root causes of violence, and also who is really at risk. And what we see in the data is that we need to address violence, teen adolescent violence, not only thinking that gang members are the ones that are involved, but understanding that our youth are in crisis. In terms of substance use, and this is gang member substance use, you see what that is and how often they're using substances, again, from the gang assessment. The data for middle schoolers and high schoolers generally in Durham, the number of young people that are using drugs past 30-day use, according to the youth risk behavior survey, that number is going down. Weed is staying the same at around 22%. But for opiates and alcohol, it's below 20%, around 16% or so. And that is a vast improvement over previous years. And so then we look at where we need to intervene versus what the perception may be. If we wait until young people are 12 years old, then we need to understand that's a problem. And so there's so much attention, I think, on intervention until we don't think about prevention in terms of how do we make sure that the next generation is not presenting with some of the concerns that are there. And so we want to make sure that 9 years old, especially by 10 years old, that we need to start looking more closely, and even 8 years old, but looking more closely of how we are preventing substance use, gang activity, risky behaviors in even young people. Because the numbers of, and this may seem like it really doesn't have anything to do with much of anything, but energy drinks, for example, is a huge issue. And why would we want to address energy drinks at the elementary school level? Is because there are young people in elementary school that are drinking 2 and sometimes 3 cans of energy drinks a day. So when we want to prevent the use of anything that is dangerous to a young person, then why not look at what they like and what they think is acceptable? A young person should only have 100 milligrams of caffeine a day if they are going to have it. And that's for ages 15 to 18, 100 milligrams a day. And in our discussion, we had a mom of a 4-year-old. Yes, she was 4 years old, that happened to see something on TV when she went grocery shopping with her mother. She said, I want that. That's what I want to drink. Well, how do you know about it? What do you know about it? And so to think about where we start, we look at the things that appeal to young people at a very early age. We address that so that they will discover or identify for themselves that this is not something I should have in my body. And then the reasons why. In addition to that, what is it that young people say, gang related or not, are what they are wanting? They want a gang member feels like it's like family. These are things we've already known for I don't know how long. We've been looking at this since the first gang report in 2007 and saying the same things over and over again. They like support and loyalty from each other. The gang makes them feel like they belong, and the gang protects them. So what is it that young people need generally? They need family, commitment, committed to each other, a sense of belonging, and they want to feel and be protected. So it doesn't necessarily take a gang in order to do that. But what are some of the things that we can do as a resilient community, or those who interact with children, period, that will shift the norm? This is the other change that we saw again. So why do we think that this is a crisis? Well, for some of the that's some of the reasons that you've already seen. Now, this has to do with the numbers of young people that decided or considered suicide, made a plan for suicide, or attempted suicide in middle and high school. This doesn't mean that 45% of all Black African American middle school students considered suicide, made a plan, attempted suicide. It means that out of all of the young people, whatever number that is, that said that they considered, made a plan, attempted, then of that number, 45, 43, 47, 42, 45, 41% of those individuals were Black African American. Never before in the times that I have looked at this data have I seen these numbers. It's usually white students that report these kinds of things. And so here we have another situation where our children are in crisis. So, you know, what's happening here? Why is it happening? And what can we do about it? So probably 5-10 years ago, when these percentages were about even, Black African American students, white students, you know, they were pretty much the same, or Black students were just a little bit below the percentages for white students. I raised the red flag because, you know, the group that Durham wanted to address more so were white students or LGBTQ plus students, which I understand that that's a concern. My concern was, why don't we address this among all students? And that did not happen. Hopefully, not hopefully, it will happen now. So when we asked a group of young people, so we have a youth coalition, Living in Future Tense. Over the summer, we have 2 pages of results concerning what youth have said. And so we're just looking at this particular response. When asked, what does safety look like to you, they shared the following responses: being able to learn, because they thought in some school settings it was not real possible to learn because of distractions, concerns, student behavior, staff behavior, that kind of thing. Building relationships by getting to know others and their stories. Okay, so, you know, this sense of belonging, and just think about it in terms of what students need, children need: being able to be my authentic self, feeling safe on the bus to school, good family influences and relationships. We want allyship and safety with others who are different than us. So they want that coming together, which doesn't necessarily happen in a school setting. But we set these situations up in the larger conversations that we had with young people, putting them at tables with individuals that were not like them and having them talk among themselves with a trusted adult so that they could see, well, wait a minute, you know, we may be different in our appearance, but our concerns are somewhat the same. Hillside students staged a walkout about 2 weeks ago because of the violence that they felt was occurring at Hillside High School. They walked out. But then what happened after the walkout? And so Wendell and I'm sorry, Tab, who, you know, did the presentation of State of Urgency, he and I are partnering together on this initiative, and he's taking it statewide. So in addition to his showing sense of urgency, there's a call out to parents and community members and youth to become a part of this process. And so I'm certainly not going to read the whole resolution to you. It's available online and people are signing up for it. Individuals that sign on to the resolution will have their name in the resolution so that when we go to city, county, Board of Education, then those individuals and organizations will be listed in as supporters of the resolution. So in terms of what we want to do, and I excuse the typos here, we want to use a screening, brief intervention, referral to treatment, or SBIRT process. Now, there's an SBIRT process for substance use. And what that means is that there is a screening or a survey for substance use to determine how many of the whole are in need of a talk, a more extensive talk, or a referral to treatment. So that's how it reveals itself in a substance use perspective. But in this perspective, we're looking at resilience, a resilience survey, not an ACEs survey, because we don't necessarily want to talk to young people under the age of 18 or maybe under the age of 21 about adverse childhood experiences. But resilience, what does resilience look like to you? In other words, what supports do you have um, uh, uh, personally in terms of self-control, self-care, those kinds of things. Interpersonally within the family, community, what does that look like in the community? And then societal norms. And so how can all of this be done? Because obviously there's a shortage of mental health, substance use professionals to meet the need. And so this kind of process would be carried out in the school through mental health, substance use professionals who have volunteered to give their time to this process. And so that's the co-developed mental health and should be substance use consortium. And so right now we have, and we're building this up, of course. That's what this process is about. It's not about having everything in place now. So, and then this, where it says that we, and it has together for resilient youth and those that are in agreement. When you log on to sign the resolution, you'll see all of the other names of people, organizations, etc. So we have members of the Board of Education, the Durham Committee on the Affairs of Black People, social work, NCCU. So there are lots of other organizations that have signed on. And this is just the first iteration where we hadn't even put the resolution online yet. That was October 17th. And there are people that are continuing to sign on to the resolution. You already heard about brief interventions. And therefore be it resolved, resource should be provided by organizations, including community-based organizations that are free, affordable, with easy access to meet the needs of individuals, young people, and families in the community. And that we will do this together, working with schools and community programs that have a trauma-informed resilience process as a part of their program. And if they don't have it, we're happy to help them with that. So lastly, there are 7 strategies for community change, which is another part of this process, where community members, and they have already started to do this, they're called champions of change, can sign on for one or more of these strategies to participate in. They don't have to sign up for all of them, but whatever one they have experience in, or that they want to learn more about so that they can assist, then they will do that. So providing information is something such as anywhere they can provide information that will be given to them. Campaign #AllKids. And to learn more about the misdemeanor diversion program. Building skills, what does that look like? And then there's several ways that that can be done. Providing support, Do people need childcare or transportation? Enhancing or reducing barriers, helping assist youth to utilize activities or helping them to have experiences beyond where they are in order to have the mindset of something to look forward to and outreach to and for. Changing consequences, incentives, disincentives, increasing public recognition. So for young people, what's right with you? What are your strengths? They receive certifications, and there may be other programs. So it's not just T.R.Y. And receive compensation, incentives for the work that they do. Physical design, what can change in schools? Young people have said in these 2 pages of information that they provided is that they want metal detectors. They want more SROs in the schools. And so while there are adults that are saying they don't want metal detectors, they don't want SROs, we're talking about what students, and these are high school students, what high school students say that they want. They want mental health days, which doesn't mean that they just get a day off to do what they want to do, but some kind of process within schools on however many days. This can be whether it's once a week, once a month, once a quarter, where everybody in the school, including administration and staff, have time to focus on resilience and self-care, helping to change the culture at schools. And Superintendent Mubanga has said that he's planning to do this at least on a quarterly basis, modifying or changing policy that has to do with what we've talked about already, like the resolution. And of course, individuals are still talking about what they see some of these strategies to be co-led, co-identified by the community. So, okay. So I'm going to stop sharing to get some of your thoughts about where we are with this. So we have the resolution that's already out there to be signed. We have the 7 strategies for community change that people are signing up for. And so this is where we are with this HEAL process. So does anybody have any thoughts or other things, in terms of, the expert process that you would like to share at this time? So just to say, this is the point that we're at in terms of the strategies that we are providing for the HEAL project. And just wanted to update you on the process and include you in the process as well. So if there are no comments, we can close for the day.
Dr. Boone, thank you so much. Very informative. I love the strategy for Durham. So are we going to be able to implement some of these practices in Vance County as well?
Yes, that's the whole point. And then, of course, Vance County may be a little bit different than Durham. I'm gathering the data for Vance County so that it can be included and the areas where Shamika is involved as well.
Okay, so just know I'm available to get whatever you need. If that doesn't come from DHHS, I can definitely get data out of the school system if you need it. So thank you for all your hard work. Appreciate you.
You're welcome. Nancy, you've been on the ground, so what would you like to share about what's happening in the community about energy drinks, champions of change, and that kind of thing?
Yes, good afternoon, everyone. Thank you, Dr. Boone, for holding this meeting. There's a lot to talk about. The Youth Coalition, which is Living in the Future tent, had the opportunity to do research during the summer. Since the summer, we've been not only the youth were able to create a petition wherein we have gathered several signatures. But before I go into that, I do want to say Dr. Wanda Boone has been working on this petition and on this policy since 2015, and it is something that is definitely raised eyebrows due to the research we did during the summer of 2023. A lot of the youth
That's
and
the
middle
energy.
school.
Yeah, I'm sorry. I just wanted to say that that's the energy drink petition working with the health department as well. Go ahead.
Oh, yes, yes. I apologize for that. And we, the students have done a lot of research, as Dr. Boone said earlier. The middle schoolers, we find out they're actually drinking 2 or 3 times more energy drinks than high schoolers, unless they do play in the sports. If they're in sports, they are drinking about the same amount or more. And it is bizarre because they're only allowed to take 100 milligrams per day, and they are taking about 2 or 3 cans, not necessarily cocaine energy drink. And even though that is a bizarre name, there are other energy drinks that are in Walmart, Target, CVS, and Walgreens that the energy drinks percentage are higher than the cocaine energy drink. There are more than 240 milligrams. We've done research and found other energy drinks that are 300 and above milligrams, and kids are taking them 2 or 3 cans per day or more. And they are very deceiving. In the matter of fact, I will share, it deceived me. The energy drink Celsius states that it has 0 sugar. It's good to lose weight, and it's a sparkling water. But let me tell you, it does have caffeine, and it has 200, I believe 200 and 250 milligrams. And a lot of kids are drinking those as well. We were the Youth Coalition of Living in the Future tents worked very hard in doing the research. They collected during the summer, and also they've collected near about 500 signatures. So I hope Dr. Boone is able to share the link so you can also support us. It would be amazing if you guys do. And most definitely support the work that the youth is doing, because a big it is a big issue. Because most importantly, because it is easy for the youth to go in and buy. It doesn't matter what age you are. No one's going to card them, and they can buy packages. And it is also very convenient that they are in all of the grocery stores where it's very easy access. Also, it is dangerous because we personally know someone who passed due to energy drinks. Of course, every case is different. And recently in the news, this young lady passed due to drinking a lot of caffeine from drinks from Panera. So most importantly, it is a topic that a lot of youth are not drinking these drinks responsibly, and some parents are not even probably aware of it. Some probably don't even know that those drinks have caffeine. Like I mentioned earlier, I was deceived with the one with Celsius energy drink. I actually purchased one for my daughter, thinking I was fooled thinking it was a sparkling water drink, but it wasn't. It was a caffeine drink. And so, and most importantly, the work that the youth are doing, educate them, and they got to learn. And what I found unique was how when the youth go out there and share with adults, also adults are very afraid and scared how, oh, I did not know I'm only allowed to drink 400 milligrams per day. So adults are allowed 400. And they were so surprised because they drink probably 2 to 5 drinks per day. And they are concerned because they're realizing, oh, now I see why I'm always having anxiety. I'm always feeling like I need more energy. I'm not really getting energy. So it's really unique, and we appreciate Dr. Wanda Boone for sharing and giving this opportunity to the youth. As always, education and knowledge is key. And thanks to the education and knowledge that was provided to them, not only they got to learn how to create a petition, they also were they also went out there and gathered so many signatures. And that was all that. Yes.
Yeah, thank you. And so it's not just energy drinks. The teenagers receive well, first of all, anyone across the country can join Living in Future Tense, or across North Carolina, or across Durham. And so they get a tip every month, depending upon the prevention tip. So October was bullying. And so they received a tip from the CDC, and then they share that with their parent. They share it with at least 2 peers, unless their whole school is a member of LIFT. And then their counselor, social worker, or whoever it is, that's the adult that oversees the process, they share it with the entire school. And then young people make the tip their own. They write music, they write poetry, they do spoken word, they do videos in order to show how the tip, which was bullying or suicide prevention. So we have a different tip every month. And so they're able to make it their own and apply to and for other students. For Champion of Change, we have lots of adults that have signed on to be champions of change. And then, of course, the resolution. So I'll make sure that I think it was already in the email, but I'll send it to Melissa because I don't think that she shared it with you, Chief. And so I'll just make sure to send that out again. And when Nancy mentioned cocaine, excuse me, that's the name of the energy drink. It doesn't have cocaine in it. I mean, it's just crazy. And Chuck Schumer has a something that he's presented at the federal level to hopefully stop the use of prime energy drink, which is the big deal now across the country. I've sent information to our North Carolina representatives so that, not to ban the sale of energy drinks, but the can already says that it shouldn't be consumed by anyone that's under 18. And so, we have hopefully the petition that goes to our state representatives and then forwarded on to Chuck Schumer. Of course, he didn't respond to me, but that at least we can say, stop the sale of energy drinks to anyone that's under the age of 18, just like the North Carolina Attorney General changed the legal age for purchasing tobacco from 18 to 21. I mean, that was done in North Carolina. So I don't see what challenge there would be for increasing the purchase age for energy drinks to be 18, as it says on the can. So yeah, there's a lot. Again, so all of this, as I've mentioned for the past 6 months or so, is open to everyone across North Carolina, but especially Region 4, because that's the region that we're working in. So it's been forwarded, and hopefully with you on the call today, you can help further this process along. Whew, okay. Is there anything else? Okay. Thank you so much, and have a good day and rest of the week. Bye.
Thank you, Dr. Boone.